Good morning, and thank you for attending today's session entitled Preventing Health Equity and Belonging Leaders from Becoming Collateral Damage in the Fight to End Institutional Racism. My name is Duane Reynolds, and I'm the founder and CEO of Just Health Collective. Just Health Collective is a consulting and advisory services firm that is focused on accelerating health equity and belonging in health and healthcare. I'll be your moderator for today's panel session, and I'd like to start off by providing a bit of context about our discussion. You all know better than anyone that health equity and belonging initiatives are cultural uphill battles that require patience, persistence, and tenacity. We talk a great deal about what is required to make change, including vision, strategy, tactics, and accountability. But we talk less about the personal and professional sacrifices made by the individuals that are charged with leading these cultural transformation efforts. Today's panel discussion is meant to explore the very real impact of health equity and belonging leaders becoming collateral damage when advancing transformational initiatives in their organization. A recent article from the Wall Street Journal pointed out that chief diversity officer roles have been marked by high turnover, with many in the position leaving over a lack of resources, unrealistic expectations, and inadequate support from senior executives. And this is according to former chief diversity officers. The average tenure for these roles is approximately 3 years. Many health equity leadership roles are new, but comparable in terms of cultural transformation required for success. Professionals leading health equity and belonging transformation become collateral damage when organizations themselves fumble with DEI and health equity initiatives or are steeped in institutional racism and power imbalance. Companies tend to retaliate against these very people that have been recruited to transform the organization, and this can come in both subtle and dramatic ways. Today, we will hear from leaders in this space, discussing their own personal experiences and what they believe might be solutions to address this problem. Now, I'd like to introduce each of our panelists. First, Jesse Bridges is the Senior Vice President of Diversity, Equity, and Inclusion at Everfi. Everfi is a digital learning platform that provides scalable learning solutions for education grades K through 12. Next, we have Andres Gonzalez, who is the Vice President and Chief Diversity Officer at Froedtert and Medical College of Wisconsin. Froedtert Health is a regional health network that is in partnership between Froedtert Health and the Medical College of Wisconsin, supporting a shared mission of patient care, innovation, medical research, and education. And finally, we have Dr. Maria Hernandez, who is the President and COO of Impact for Health. Impact for Health is a multidisciplinary team of community psychologists, public health researchers, physicians, and health educators who promote health equity. Now, Jesse, I'd like to pose our first question to you. We've all likely worked for organizations that are more performative than action-oriented when it comes to health equity and belonging work. What are some of the signals that are important to consider before committing to lead transformation in this type of organization?
Certainly, it's a fantastic question to consider, Duane, given the exponential increase in the roles that are focusing on health equity and diversity, equity, and inclusion. And so, I think that there's an opportunity when you've been approached or you're pursuing a role that focuses very squarely on this. In terms of the research or the intel that you can assess going in up front. And oftentimes, I'll use a 4-pronged framework to really look at the organizational strategy, and I would say the organizational commitment around diversity, equity, inclusion. And really you can focus on that from like a maturity curve. I would say many organizations and institutions are progressing. This isn't the first time they've considered it, but really considered it with fidelity and really amalgamated throughout the entire organization are things to consider and to look at. So, if you're considering an opportunity and a posting, One thing to understand first is, what are the resources that are going to be available to you walking in the door? And I want to specify and segment those resources in terms of human resources in relationship to the headcount of the organization, as well as the fiscal resources in relationship to the total budget line and the allocation. Many of these positions are positioned as, oh, it's an exciting opportunity to build a team and to build the scope of work and sort of create the work for yourself. And that can be remarkably exciting if there are dollars set aside to build an actual team in terms of headcount, but then also on your training agenda. Those don't come free of cost, whether or not you're building in-house or you're procuring an outside vendor. So I think the resources are the first place to investigate and explore with the team. Secondarily, I think there's a lot of outside qualitative data to be assessed. People can say one thing or another about platforms like Glassdoor, that they're, in a lot of ways, they're sensationalized or kind of the bookends of experience. So I think you can take that for a grain of salt. But if you look at the Glassdoor ratings and reviews, one, there are the quantitative metrics of the new DEI ratings that platform has put out, but then there's also the qualitative narratives of people there. And so when you start to see themes around inclusion is done right or inclusion is really lacking, thematically, and you hear those reviews over and over again, that is something to be considered and to be taken seriously. Because there are employees who might have left the organization. Maybe they didn't say so in their exit interview, but they are saying it on broader platforms. You also want to consider, where is the position? What is the reporting structure within that organization? How many layers removed from authority and influence will you be? And you might not necessarily be reporting to the CEO or to the COO of the organization, but are there strong dotted line relationships that would manifest in having the appropriate level of influence and authority when it comes to decision making? And then also I would say, looking at leadership commitment. What public and private statements have been made? I think it's easy, and to that point about being performative, it's easy to make very public statements. And many organizations did, and rightfully so, during the course of last summer. And the questions of exploration are, and what happened thereafter? After this public statement, or that you blacked out on Tuesday, or you made a public commitment, what were the cascading actions that happened thereafter? Did you form a council that was providing strategic recommendations, and that's how they came into creating this role? So I think there are a series of questions about leadership commitment, what investments have been made thus far, and what's already been forecasted, or are they waiting on the individual to come in and create it all from scratch, if you will? And so for me, it's important that there's been some level of strategic and deep thought, even if an organization is just getting started, around how they're informing their strategy going forward, and what access will you have to data, both quantitative and qualitative, to inform the strategy that you would create in the organization.
Thank you. That's a really great answer. So we're looking at where it reports, sometimes qualitative information that provides themes from places like Glassdoor. We're looking at both the human capital resources and financial resources that are there to ultimately allow this leader to be successful in transforming culture. And I really do think that at this juncture, for most organizations, particularly organizations of amicable size, we have to have a position that has executive influence to really be able to move the organization. And I think the higher you can get to that CEO, at least in the relationship that you have, the better it will be for trying to move things throughout the organization. So Maria and Andres, anything that you would add relative to what these environments, a healthy environment, looks like for someone considering these types of roles?
Thanks so much, Jesse, for kicking us off with a great summary of ideas. Good morning, everyone. One thing that I would do also, even before accepting the request to interview, I'd look at the website of the institution that you're joining. And one of the telltale signs in our firm of a place that poses an opportunity is, do they even mention diversity, inclusion, belonging, health equity as a theme in mission statements or values? Does it even appear as a designated site within the website about what they're trying to advance? Most hospitals are providing a community health needs assessment and a community benefit report. That's often the place to look to see what kind of commitment they're making, not just within the four walls of the institution, but we know in partnership with community, because that is sort of the secret sauce to make sure you're advancing health equity. It can't happen just by yourself inside those four walls. And I think anyone seeking a role with an institution should take a look and see what they say about themselves externally.
Yeah, those are great ideas. And first of all, good morning, everyone. And thank you, Duane, for inviting me to be part of this esteemed panel. I concur with all the comments that Jesse and Maria have made. I also would add that one of the things that I have done historically is maybe landing a day or so prior to my interviews and doing mystery shopping, right? You want to go in and really experience the culture. I've navigated the hallways of the healthcare systems. I have asked questions, and I think Maria brought that up. You want to make sure, right, that you understand what's the culture like, both in terms of the internal culture, right, in terms of that, whether they are delivering, right, a great staff experience. And then, as importantly, what's the patient experience like in that healthcare system? And so I've been able to do that and really gain greater insights through that, and looking through that lens and hearing what staff and patients have to say. And then kind of mirroring that as well during my formal interviews, asking the healthcare system if they have diverse leaders and if they have BRGs. I want to talk to them. I want to hear from their perspective, right? What's the lived experience in that particular organization, right? And then furthermore, speaking or engaging with community leaders. Actually, here at Freighter, that was one of the things that I didn't have to ask for. And it was probably one of the greatest signs for me, where the organization was very strategic, very intentional in making sure that in my schedule itinerary, I had some interviews with internal stakeholders, leaders, diverse leaders, as well as external stakeholders and leaders. And these were kind of the record type of discussions, right? Where they were asking me to ask any question that I had to those leaders, right? That they would provide me a great balanced perspective or answer to my questions. And to me, that spoke volumes about, where Freighter was at in terms of our own maturity, in terms of our efforts, and the willingness, right, to take the risk that some people were going to tell me the good, the bad, and the ugly. So that was actually very helpful. The only other thing that I would add, and I think I want to underscore that point that Jesse made as well, has to do with, once you start looking at what has been done strategically, I like to look at the impact, right? What type of metrics do we have in place? What type of impact, right, has been achieved? And I think that will glean and provide a very clear perspective and will tell you a great story of what the system, right, has been able to achieve or done. And I think, to the question here at hand, is it performative, or are we very committed? And if so, right, the proof is in the pudding, as they say. I want to see what the results are and how they've moved the needle. So I think that both of my colleagues were spot on in terms of their answers there.
Thank you, Andres. And to that point, I think one of the easier ways that you can look at outcomes is understanding what the diversity is of that community that the organization is in. Looking across percentages of race and gender, and then looking at the board and the senior leadership and who is represented from those perspectives. It doesn't mean that you will necessarily walk into immediate challenge, but it does give you an indication of whether or not they have likely worked on the issue of diversity at those levels. Because what we are now truly understanding is that the lived experience really matters to creating environments of inclusion and ultimately being able to move health equity forward. So Andres, this next question I'd like to pose to you. So people express 2020 as really a catalyst for a triple pandemic, and that is systemic racism and the murdering of African American Black individuals, a faltering of our economy, and COVID-19. So, how have these conditions exacerbated the challenge for health equity and belonging leaders from your perspective?
Absolutely, great question, and so thank you for the question, Duane. I will share that I think the triple crisis exacerbated, and if anything, it really exposed the realities experienced by our Black, Indigenous, people of color, right, BIPOC, and marginalized communities. It really put diversity, inclusion, and equity in the forefront here in America, right? We just couldn't sweep it under the rug any longer. We had to deal with it, just given the realities of what was transpiring over a year ago. And I think for health equity and belonging leaders, the sad part is that many of them have had to endure, internalize the stress and the collective trauma that they have experienced because they had to be on the go, right? They had to actually be responsive to the needs of their organizations, right? In our case, of our healthcare system. Unfortunately, as people were impacted by this triple crisis, they were not able, right, to really deal with it. They just didn't have the time. And so many of them had to put a facade. And so I remember having, to have this crucial conversations with my own team. And I remember as we heard, unfortunately, of the death of George Floyd in Minneapolis, where I was texting in real time my African-American staff members and leaders and saying, hey, how are you doing? Are you holding? I mean, what can I do for you? And actually, I remember months later, not that same day, not the next day, months later, I had one of my directors who, Duane very well, who actually said with teary-eyed and said, you don't know how much it meant to me that you text me in real time and you said, how are you doing? How are you holding in this very trying time right now? And says, that was actually just a little maybe action on your part that meant the world to me. Because I knew that I was visible, that I mattered to you, that you cared about me personally, as well as professionally, and that I knew that you had my back. And so I think that those are the realities of many of the individuals that unfortunately do this work professionally. And what I'm hearing is many individuals right now, because they haven't had that nurturing culture and environment, what I'm hearing from many of them is, hey, I'm fatigued. I can't handle this any longer. I am actually at the brink of burning out or have burned out. I actually know a number of colleagues, either here regionally or nationally that have literally walked out of their roles within healthcare systems and said, can't do it anymore. I'm just exhausted. And there's no way that I can continue because actually, right, I'm running on empty. And so this is the reality for many of our colleagues. And so I don't know that we understand the full impact that this triple crisis has had in America, and especially to our field, to our profession, to our colleagues until, a couple of years from now, right? When we start seeing truly the impact that individuals have endured and what happens right within our field. And so I'm actually really concerned not only for their lives, for their livelihoods, but also in terms of our field, right? I think we might end up with a vacuum in our field where we do not have the next generation ready to necessarily step into those roles. Or what are we going to do when someone then gets tapped right on the shoulder to come into this role? Are we willing, right, to mentor them, to nurture them, to come alongside, right, to ensure that what has transpired during the triple crisis doesn't, right, manifest itself in the next generation, right, next year or 2 years from now. And so that is a lot of the realities that I hear from a number of colleagues that they continue to endure. So when you're dealing with ambivalence, when you're dealing with the uncertain times, when you're dealing with a lack of commitment, you start wondering how valued and appreciated am I, right, as a human, as a professional. So those are the type of things that certainly I think I have been paying attention. To, and those are really clear signs to me that either we need to be proactive and responsive to that need, or else, right, we're going to see how a number of our colleagues, unfortunately, are going to just burn out and leave the field altogether, and it's going to be a huge loss to our health systems, to our communities, right, and to the I think to the monumental efforts and strategic imperatives that we have been driving, right, and collective impact that has been made thus far. So those are some of the things that certainly I would share here, and some of the things that are keeping me up at night, because I know that certainly those are the type of things that I know that my leaders, my diverse leaders or BIPOC leaders, are dealing with on a daily basis.
Well, thank you for that. One thing I wanted to note is that you did point out that a lot of these leadership positions are filled by communities of color, by women, by those of us who have been marginalized. And so, what happened during the triple pandemic was that much more impactful for those of us still having to do the work amidst our pain, right? And I don't think we talk enough, quite frankly, about wellness and resiliency of leadership positions like this. In healthcare, we've been squarely focused on physician and clinician burnout, but the reality is there are other roles, particularly roles like this, where you're trying to do transformative work, and it already was difficult, let alone have the things that we had happen in 2020. So Jesse or Maria, would you like to add anything to that?
Go ahead, Jesse.
No, Maria, please go ahead.
All I was going to say is I know of one other stressor, Andres, and hopefully Frodert has not gone through this, but in some systems, the unique patient population that they were serving began not to show up for elective surgeries or other procedures that are timed or planned. And this created a financial fallout for that type of system. And so on top of the stresses that Andres laid out very adequately and very poignantly, another stressor became for some, you still need to do your job. And oh, by the way, we're going to have to cut staff, or we're going to have to cut budget, or we're going to have to ask you to play this other role for a temporary period of time. And of course, in the midst of the pandemic, certainly the front lines, everyone did everything possible to meet the needs of patients. But at some point, you got back to your office and you realized, oh my God, I don't have the budget, or I don't have the same staff anymore, or I have even twice as much more work to do now because I'm under a microscope. We know health inequities exist because of what happened with the pandemic. And here you have a person, a human being, trying to respond to all of that. So that's another layer of the stressors, Andres, that I think we've all seen, and we're all very concerned for people still today, still trying to navigate what they're going to do because of those changes that were made in their system. Yeah.
I'll add on to that, and maybe it's more summary than it is adding any new information, that we framed it as the triple crisis. But I would dare say if we pull together what Maria and Andres has said, there's a quadruple crisis that's happened. And the fourth element of that is the mental health crisis that globally people have experienced an adjustment disorder to an abrupt disruption of life as we know it. So everyone, and I don't say this lightly, experience a diagnosable adjustment disorder. And so the idea of mental health coming to the epicenter of everything that we do and thinking about wellness holistically is something that we're still grappling with. But you see the exponential increase in diagnoses of depression, of anxiety, of comorbid disorders like depression and anxiety together, that, while we are all collectively experiencing this trauma, there are the intersectional layers of the people who are doing the work that we started to point to in terms of the number of BIPOC women who are doing health equity and DEI work. And so there was everyday microaggressions that we experienced pre-pandemic. And you then layer into that the additional stressors that came with the pandemic. And so I think the concept in the conversation about the mental health crisis is one that that just has so many onion layers to it, as you consider compassion fatigue, as you consider racial battle fatigue, and the practitioners who are stewarding this trauma within their organizations while trying to be responsive and trying to be strategic, and at the same time hold some space for self-care that I would say personally, was put on the back burner in order to show up on behalf of a lot of other people. And so I think that there's that, and Andres and Maria, you both started to speak to it, is that in the midst of this crisis, equity came to the epicenter of how organizations thought about caring for their people, and caring for their systems and continuing their operations. And so there quickly became this issue around capacity of health equity practitioners and DEI practitioners, because you went from being the buddy of HR practice to really informing every element of how the organization would move. And there was still, it wasn't that they instantaneously added 3 more staff members to your team. It was a matter of, now we need you in 17 places as opposed to 3. And so that idea of sustainability and operating on all the cylinders at high octane when you don't have the space and time to replenish because you're also homeschooling quite possibly, those are the factors of sustainability that will have a residual effect on the field, as Andres was pointing to a little bit earlier. And so that idea of sustainability was exacerbated and was compromised, I would say, throughout the course of the pandemic and this quadruple crisis that we're all, still contending with and we're still navigating through. And so, while it did bring the importance of the role and the roles to the center, it really came at the cost of not necessarily being equipped in the forefront with the proper resources for many organizations. That's not to say all. And then, really kind of saying, well, can you also inform our communication strategy? And can you also continue to inform, like we have to downsize, and how do we make sure that we're not disparately impacting particular staff, or we didn't think about that and now we're having to deal with it on the back end. And so, informing all of your practice around or through the lens of equity became kind of premium. But the currency to that were the same number of people who were doing the work. And that's where we talk about that focus on collateral damage, in placing the work at such high importance and a higher premium. But did we equally place that importance and premium the people who were doing the work? And I can say in retrospect, I don't think that collectively we did. And now we're trying to forecast a more sustainable future moving forward.
All very good points, and in particular, the mental health aspect of this, because that is a silent disease that can often take people out. And so, having that under consideration as we think about these roles and think about replenishing and resiliency of our own mental health and well-being becomes a really critical part of even considering going into a role like this. So the next question that I'd like to talk about is the idea of psychological safety. And we know that it's really critical to create psychological safety in our environments, but there's an element of that I think is important for professionals who are doing this work as well. So Maria, I'd like to pose this next question to you. What are the ways to try and secure a role, meaning ensuring that you have psychological safety as you step into these environments, and how one might avoid becoming collateral damage, being pushed out of the organization, all those things that, we hope that most people don't have to experience, but we really know that some do.
Yeah, and I hope anyone watching our session today isn't getting too discouraged by hearing about so much of the challenge and so much of the difficult work. I think it is incredibly important, rewarding work. I've been working as a consultant in this field for almost 25 years. But here's what I've noticed of those chief diversity officers, chief health equity officers that are thriving in the roles that they have and feeling good about what they do. There's 3 things I notice about them. first and foremost, they manage expectations very well. They understand with X amount of budget or X amount of staff, there's only so much that can be done at any one time. And so they're very cautious about what they commit to, what they promise, and in fact, challenge the status quo by saying, if you want these things, then you really do need to have this budget, these numbers of staff, or these infrastructure changes in order to support the work that is required. This is a marathon. It's not a race. And so I think they're very cautious about what they promise, what they choose to focus on during the different levels of engagement that they may have with senior executives. So that's number one. Don't set yourself up for unrealistic expectations of what's doable in the amount of time that you might be using for your strategic planning process. The second thing I notice is that successful executives of all stripes, but in particular here, is that these executives often have a sponsor. They're partnering well to align themselves with another senior executive. It could be the chief medical officer, the chief operation officer, hopefully also the CEO, but they find someone who really gets the link between quality of care and health equity and working on a place where people feel like they belong. They find that individual who will shoulder with them some of those challenging moments that we've been describing, but also institutionally, they get the mission of the organization from all sorts of angles and have decided very strategically to weave health equity into everything they do. So that partnership is key. And I think we all know the success in particular of people of color, women, LGBTQ community, we know we do better if we have a sponsor. And one side comment about that is it doesn't have to be a person from your own cultural reference group. It can be someone outside of that who simply gets it, who is really, truly committed to what you're doing and is going to support you. So sponsorship. The third thing that I notice is, and I'll close on this so that everybody can chime in with their other perspectives on this. The other thing I notice is that these individuals are incredibly good in keeping their network alive. So, you can get inside a job, you can get buried in everything that we've been talking about. You put in 16-hour days some days because of all of the challenges that are going on. And if you begin to isolate, if you begin not to have contacts with others in other institutions, you start to not see, others who can give you some grounding about how you're doing, what you're experiencing, and give you that perspective. The other is that network often can be not just a safety net, but it's a place where you can turn to and say, how would you approach this? How would you try this specific issue at hand? And I think the network building, both internal and external, is another safety mechanism to the point that Jesse made about your mental health, right? Isolation and depression go hand in hand. And if you're feeling totally alone, that no one else is going through what you're going through, it is just compounded, right? So I want to leave space for others to comment, but I think, again, managing those expectations, having a true sponsor that supports you, and making sure you keep your network alive so that you are not alone and, just using yourself as your sounding board. I think all of those factors are key in creating that sense that you have options, that you have others that are looking out to support you, and that you are truly being your own best advocate by not committing yourself to something that's just not doable. So let me pause there and see if there's other ideas.
Thank you, Maria.
Fantastic. I am always one for a good framework, and that three-pronged approach of your managing expectations, having a sponsor, and keeping your network alive. I think that is just, it's really crisp, Maria. So thank you for that. And, I'll underscore the piece about managing expectations, really clearly, and in relationship to psychological safety, which, is in part defined by, the ability to contribute and the ability to fail and to test new ideas without fear of retribution, without fear of losing status on the team. Those are scary waters to walk into, that I'm going to say a thing that feels innovative, or it feels novel, or it feels kind of outside of the box. And the conditions are set that I can say this thing or try out this innovative novelty without kind of compromising my well-being or my living, if you will. I think those are the trepidatious waters that we walk into in doing health equity and DEI work. But that's what is sustainable. That is what is psychologically safe. And that's where, when we have that sort of freedom to contribute and try things out, that's where the innovative breakthroughs come from. And that's where they come through. And so I think in that lane of managing expectations, creating really clear demarcations around how we process and how we respond to failure is one that, as a leader, you can start to set for your team now, that you have permission to fail, and you have permission for this thing not to fly in the way that we thought that it would, but we're going to tinker around with it, right? And so I think creating that expectation for the teams that you manage creates psychological safety, but then also managing that expectation up in terms of, we're going to have very data-informed, quantitative and qualitative informed strategy. We're going to operate on that strategy with discipline, and we're also going to create this space to be a little innovative. And in this innovation, we have the liberty for it not to be as successful as we think it might be. And so I think, managing up and managing down when you're creating the conditions of psychological safety is equally important in terms of, securing your role, but then also creating those conditions where innovation has the opportunity to thrive. And so, again, if we look at that clinical definition of psychological safety, it is kind of that mental reprieve from being so afraid to fail. And then as the cost of failure is compromising, everything that you've built in terms of credibility within the organization. I just wanted to add that into the layers of managing expectations and that really strong framework you presented, Maria.
Very much appreciate that. I also would just add that the relationship that you have with your direct supervisor is also very important. And asking the tough questions before you agree to accept the position, I think is really important, because you want to know where that person stands, right? You want to know how they will back you in circumstances where the waters are going to be turbulent, because they will be at some juncture. So that becomes a really important part of the.
Duane, it's interesting. One of the things I often suggest to new executives is that they should ask their immediate supervisor, how will we disagree? What is the way that we will know we need to disagree about something, and how are we going to handle it? So to both of your points, making sure that you have almost that difficult conversation during the honeymoon phase of any relationship is a good thing to do. So just want to interject an idea there.
I just will add that I think, Duane, you're spot on about that, because I actually wrote down and wanted to share to your point, right? It's about, at the end of the day, ultimately, it's about senior leadership buy-in and support for this efforts, right? Are they treating EDI, right? Equity, diversity, inclusion, and anti-racism efforts as a business imperative, right? And I remember early on, as I was being interviewed at Freighter, having a discussion with our CEO, and I said, tell me a little bit about your philosophy about this efforts, right? What's your outlook, and what would be your non-negotiables, right? Because I didn't want to go into an organization where I knew at one point, you made that point about the turbulent waters of, I'm going to have to be the conscience of the organization. And when I have to take a stance, are you going to be backing me up, or am I going to actually stand alone, right? And I remember her looking at me and saying, I'll be there. I'll be there with you. Actually, she said to me, I'll be ahead of you, setting the tone, the expectation, and holding people accountable. And to me, that was really the right answer, right? I mean, that's the type of answer that you want from your leader, that they are not waiting for you to come in and be the savior, right? To have to be the conscience, for her to say, I know ultimately that I am the CDO here, and it starts with me. And the same way that we treat quality and safety and patient experience, we have to treat equity, diversity, inclusion, and anti-racism efforts. And I think that it really boils down to that. The last comment that I'll make that I think it's important as well for psychological safety, and I've been fortunate to experience that, is to be, highly collaborative and ensuring, right, that I'm helping, coaching, mentoring my leaders so they can start, right, connecting those dots, so they can start exercising what I call, exercising their EDI muscles, right? And I think that at the end of the day, that's probably the best role that I could play, being the chief collaborations officer for our healthcare system. If I can help other leaders understand the why behind it and why it matters to them, or I can actually understand what's keeping them up at night and I can actually help them to address those issues, I will tell you, I'm going to actually gain a number of champions throughout the organization that are going to make the work light for us, right? Because we're going to have many more hands and many more brains, right, getting involved in this efforts, leading the way, setting tone and expectations, and holding their teams accountable. And that, I think, it's part of what we bring to the table, that it's so instrumental, crucial for the health systems, right, to be able to reap those benefits.
Thank you. I was thinking about the fact that, number one, I like the title of Chief Collaboration Officer, because in reality, if you're doing well in these roles and positions, you are developing relationships across the organization, down the organization, up the organization, to really be able to influence. So we've talked about, creating this psychological safety and cover for professionals in this environment. And we've talked about, what happens if you're getting pushed out. I also think the inverse is something that leaders in this area have to consider. When is it time for you to remove yourself from a situation that really is untenable, and there really may not be the support that's necessary in order to drive the organization in the way that you had hoped? Right. So in thinking about the things that we've said over the course of this conversation, if many of those tend to stack up in the negative way, then I would, really deeply consider the impact that it has on me professionally, personally, from a mental health standpoint, and just make sure that either you're still in alignment with the organization, or that there may be a better place that is better suited for your experience and talents. Okay. So the next question that I have, Jesse, I'm going to throw this one to you, but what backlash have you personally experienced, or maybe even known of others who have experienced, when trying to advance transformation efforts in health equity and belonging?
Well, I think the question to your question, Duane, is how long do we have? Because I think that, the representative group that you have here and our audience members can at some point raise an experience in which resistance, maybe not backlash, but resistance around change has been felt. And I think if we accept as true for humans that we don't naturally embrace change, we don't run naturally towards threat, we are positioned physiologically, neurologically to protect ourselves and defend ourselves against the unfamiliar and the unknown and what feels unsafe, then you can theoretically understand why this type of work experiences resistance at a high volume and frequency, right? So that's the preamble to all of that. And, as much as these type of positions can be seen as the chief collaboration officer, and I accept that as true and think that it is absolutely right, and it is how I intend to operate, across Matrix organizations. One of the other mantras that has started to take flight around these type of roles is that you are also the chief disruption officer. So collaboratively disrupting systemic inequity.
Yeah.
If you take those things together, you are setting yourself up to have challenging and hopefully very productive, but challenging conversations, right? And so I think that's the space that I have professionally and historically found myself in. And this is my third role coming into an organization and creating the role, but then also the strategy around diversity, equity, and inclusion. And so when you walk into an organization that, has in a lot of ways thrived on the status quo, you have to first convince people that there is an issue. And some folks are walking into the burning platform. Something has happened that we have to respond to. But I've had the privilege and the honor and sometimes the challenge of walking in organizations where there's not a burning platform, an incident that's, in response to, and that's why I'm being brought in, but it's more so, the progressive sort of front of the foot. We know this is something that we need to take hold of a little more proactively, a little more actively, but in those conditions, there is the convincing people of how you need to do something different. And so the resistance or the backlash is really just kind of around change management, convincing folks that they have an issue, that they need to do something different, and then telling them why in a language that they hear. We oftentimes will talk about the moral imperative and pulling heart and head strings. And so you have to know your audience well enough to know, are they moved quantitatively by statistics and forecasting analyses? Are they moved by the moral imperative of what's the right thing to do? Do you have an audience where there's the combination of both? And I think in those instances where I assess the audience wrong, I was pulling heartstrings where I should have been pulling headstrings. You sort of get this quizzical look of I'm unconvinced that change needs to happen. I also think that in that status, in that position of being the chief disruption officer, you're sort of priming the waters for that pushback against, I like the way that I've done things before. The system has worked on my behalf, and I'm going to hold on to whatever that is. And that isn't necessarily the conversation about, privilege in terms of giving up your seat at the table. It is about, there's a process that's inhibiting, your services from being equitable, but you created that process. You were there from the beginning. So I think, in those instances, we've had those tough and challenging conversations that are about, convincing people that what you're asking them to do is worth the cost, because there's always a cost involved, but whatever's on the other side of that is worth it. I think some of the other instances in which I, personally experienced backlash, and again, not anonymized to a lot of different roles and experiences, have been around the prior to 2020, I would say, elbowing and nudging your way to the table. Convincing people that you do need to have a lens, and in the decision-making framework, maybe not you're the decision maker, but you need to have input, or you need to be a person who, agrees to that strategic decision. When you haven't been at that table before, there have been those instances where I sort of index against and rely on decision-making frameworks and say, well, here's why in this RACI chart, I need to at least, be informed or be consulted, because the output is such that if we don't think very strategically and intentionally around equity in our communication and marketing strategy, here's the downside to it. So I think it's, it's always coming prepared with the why I'm asking you to do something, and anticipating that people are going to be resistant to change, because, change often is uncomfortable. And again, if we accept that as whole and true, it gives me at least empathy and more patience to sort of work through the common denominator of why we can change together. But that's not to say it doesn't come, with a cost. That's not to say that there isn't, the backlash of, you're being too assertive or you're being too aggressive. If we were to go with that trope, there have certainly been times where, I've heard that my style is too direct, and I'm like, oh, I thought I was being remarkably diplomatic today. But when you're saying something that isn't agreeable with the status quo, it's easy to then be positioned as being difficult. And again, when you hold true the generalizations that are placed upon women of color of being direct, and that interpretation is being aggressive, there have been those instances, certainly in my professional life, where there's been that pushback and that sort of that pocketing or pigeonholing of, she's being emotional again, or she's being passionate again. And I'm like, with all of my passion comes a lot of data and information. So we can have that conversation too. So I'll certainly not be the only person who's had experience here. So I'll let Andres and Maria also contribute.
Well, and my question is, would it be fair to say that backlash is a normal part of the responsibilities and what a person leading these efforts is going to walk into. So you have to really develop the skill set, the tools to address the backlash that is coming.
Sure. That's right. That's right. And my part of my background is as a mental health therapist. And so I did not go to school to become a therapist. I was thinking I will take this skill set of active listening and reframing, and I will take it into a college setting where I will work as a practitioner for 10 years. And that's what I went and I did. But I have found that in this capacity, you play counselor and understanding not only group norms and social norms, but understanding people and their intentions, and not only their fears, but also their aspirations is critically important. Being emotionally intelligent in this role is critically important in trying to express the empathy of meeting them where they are, and understanding that meeting them where they are is going to come with a little bit of resistance and push. And so it is a skill set to cultivate. I'm not saying like everyone needs to go get a master's in mental health counseling, but I am saying that, the ideas of active listening and perspective taking are critically important in being able to sustain in this work when you do receive that pushback.
Great. Andres, you look like you wanted to add to the conversation.
No, I think it's, Jesse, well stated. I just would add that, I think we all have experienced at one point or another, microaggressions within our healthcare systems or within our settings, right? As part of that pushback that might be, much more verbal in nature. But I also have experience in my career going kind of swinging the pendulum, right, all the way to the other end of individuals intentionally going out of their way, right, to sabotage my efforts or the strategy, right? And when you see that, right, I was one of those folks that always, I'm an optimist by nature. I'm going to always come and give you the benefit of the doubt and think that you're coming from a positive intent until you prove me right otherwise. And I've seen that, and actually I have experienced that, and and it's disheartening when it comes from another top executive that you are kind of in lockstep with, right, for efforts, and you're kind of having this discussion, right, and in my case, I remember closing the door and saying, do you understand the high stakes, not only for me, but for you as well? And ultimately, if I fail, you fail, but more importantly, the system fails, right? And so, do you get that? And for this individual, he just couldn't recognize that. And his point was, I'm willing to be, certainly put myself right on the line and go through this process and, just to prove you wrong and just to certainly set you up for failure. And, it was actually a really not only disheartening situation, but one that actually opened my eyes in terms of, the thick skin that I also needed to build as part of the work. And I questioned myself at that point on whether I wanted to do this work, professionally for the rest of my career or not, because it was one of those decision points for me. And luckily, I had great leaders in that particular setting that actually came to my aid, understood the situation, were able to certainly influence this particular leader and let him know that, he was wrong and that certainly this was, a lose-lose proposition all around it. And so, certainly it had a great outcome, but going through that process and really understanding and looking at the high stakes was really a very difficult situation that impacted me, I think, for the rest of my career. So tough situations at times that you encounter, as Jesse, eloquently, stated earlier. So.
Yeah, I think your point is well taken, and I'll say, Andres, in my career, I've had a similar experience. Interestingly enough, around the word racism and whether or not racism should be used and explored in talking about health equity. And this was pre-pandemic, pre-social unrest, and now I think we have a better understanding that systemic racism is a contributor to health inequity. But these are the types of conversations that go on in the halls of these organizations as we're trying to move them forward. And there are times when sabotage, political maneuvering will occur in these instances. And it could be from a person's a scope of responsibility and authority as a leader, or it could be about their own personal bias and issues that they haven't explored related to, different things. So we're getting close to our time together, but I want to pose one last question to the group. Collectively, what could we be doing to support the well-being of health equity and belonging leaders, knowing all that we know now and what we've heard from you today?
I'll start. So a couple of things. Number one, I think at the organizational level, what is it that our healthcare systems are willing to do, right? Are they paying attention to the health and well-being, right, of our staff members or our leaders? And I think during our pandemic, I saw our healthcare system step up in ways that was refreshing and really heartening, I think, to many of us, whether it was actually something as simple as providing a meal, providing respite spaces for us, whether it was actually putting us up in a hotel room because we were fearful of going home, right, and spreading the virus to our loved ones, to bringing in EAP, right, and having counselors on site, or providing us with applications where I can actually access that, in real time, from the comfort of my home or my workplace if I wanted to, but also encouraging me. And I remember our CEO early on during the pandemic saying to me and to our team, I want to make sure that you guys take care of yourself, because if you are not grounded and you haven't taken care of yourself, there is no way that you can help me and help us, right? Stay true to this efforts. And so I remember her asking me ahead of obviously, our time here of, hey, when are you going to take time off? And I want you to, take at least along the way, a day or two, right, as part of your mental health well-being. And to me, that was actually, refreshing to hear from my CEO that she cared, right, about me, that she cared about our team, and that she was actually looking out for us. And so I think that really becomes important. I think for each one of us, right, understanding what makes me tick, how do I decompress, right, and what are the things that really I enjoy in life, and making sure that I'm actually carving out and protecting that time the same way that I protect my time, right, professionally for the healthcare system. So, you have right to create and strive for that work-life integration. And I know that probably most of the time I haven't been able to crack that nut. Oftentimes, or all the time, work wins on that particular scenario, but certainly I strive for that work-life integration as much as I can.
Sure. Thank you, Maria.
Yeah, I think one of the really great points from Andres, I really believe that we need to practice better self-care and really respect some of those boundaries that we need to establish to honor family time, friendship time, and the work time. But I also want to say, I think we need to be very mindful of some of the things that we've talked about today and be willing to be part of communities of practice. So, we know that certain techniques and strategies work in certain environments and in certain situations to support, building that culture of inclusion, creating that sense of belonging. And so I hope that we continue to try and network among ourselves, to share those practices, to talk more about how we can support each other. It comes down to really trying very hard to be there for another person, to be available, to be supportive, to be willing to hear what they're going through. And if you don't have an answer, it's okay. It's just someone to talk to about what the person is going through, I think is important. So I know we're all participating in different types of networks and different online communities. And I certainly think, Duane, you should definitely talk about the collective a little bit here, because it's a great way to engage others who are part of this. But I just think, keep focusing on not trying to shoulder so much by yourself. Don't reinvent the flat tire. There are a lot of other ways to try and work on the things that you need to do, and reach out, talk to others, and be there for others. That's what I think we all could do to make this a little bit easier time for the DEI community.
Well, Maria, I appreciate that. One of the things that I've come to learn is that my strength and encouragement in this role is really dependent on the inclusion environment that I create for myself amongst people who get it, right? And the ability to come together to share ideas, to share war stories in some instances, but to know that it is not about you as an individual, it is about the work, and that in order to do this work, we all, I think, are blessed to have the skills to be able to do this type of work, but understanding that what comes along with that is our ability to take care of ourselves, to take care of our community, to really be able to give back. And so you mentioned the Just Health Collective Village. We are a community of professionals in this space that are coming together in a digital format today, but we hope to one day be able to bring people to different areas where we might be able to fellowship, have retreats together, learn how to live in these positions and do them successfully. So I want to thank each of you for today's participation. It's been a great panel session. I think we have some wonderful takeaways that I know that individuals will be happy to hear from you all. So appreciate your time and thank you so much for doing the work that you do day in,